Hello all, welcome to Pathomad. Today we are going to discuss about what books to study for MD Pathology. Come, let's study with me. In your residency in MD Pathology, there are three postings depending upon your own college. There's first hematology, cytology, and histopathology. In my college, hematology and cytology are clubbed together at one place, and histopathology is separate. And depending upon your number of PGs and depending upon your own college, each one of you will be divided in each of these postings for a period of 2 to 3 months. In my college, we are posted at Hamat and Cyto together for a period of 2 months, and we shuffle for histopathology for a period of 2 months. In hematology, in lab posting, in hematology, we encounter peripheral blood smears. That is, hematology is primarily to do with patient's blood sample. What do you do with patient's blood sample? The clinicians send blood sample requesting for peripheral blood smears. Peripheral blood smears are mainly done to check RBC, WBC, platelet count, and their morphology to check hemoparasites. And also few samples are requested for reticulocyte count using the supravital stain. The routine peripheral blood smears for RBC, WBC, platelet count, and morphology, the staining is done using hematoxylin and eosin stain, that is the HNE stain. In all hematology labs, we have this hematology analyzers that give us the count and the percentage, the differential count of the WBCs. In extreme cases of high count or low count, you prepare the slides and check their count and morphology manually. Platelet count you check manually, and also you check for the WBC morphology, RBC morphology, any abnormal forms or any mature forms of WBCs, or any abnormal forms, size or shapes of RBC are checked under peripheral blood smears. In case of anemia, the clinician requests for reticulocyte count. This special test is done using supravital stain. And also, blood samples they are requested for sickling test to detect sickle cell anemia or traits, osmotic fragility test to check for hemolysis. And also, bone marrow aspirate also comes under this hematology. In our college, hardly we receive any 5 to 6 patients for bone marrow aspiration. And these are high-end tests: hemoglobin electrophoresis, high-performance liquid chromatography, and flow cytometry. These are high-end tests performed at higher centers. In our college, we don't have this. For hematology, you need to refer few books. These are the standard books. Daisy and Lewis Practical Hematology, it is a standard book. For bone marrow, you refer to Barbara Jane and this Tejinder Singh. In our college, our seniors use Tejinder Singh book. We have referred to that. This is a good book. It has good color images, high and low power images of peripheral blood and bone marrow as well. It has 2 volumes. I have referred to this. And these are the basic books. Kothalkas Essentials of Hematology is a basic book. And this ABC of CBC, it is a 200 pages book. It is the simplest book that you can refer for hematology. This Kothalkas Essentials of Hematology and ABC of CBC, these two books I have referred to, and I find it very useful and simple, and it is simple. Coming to cytology, what comes under cytology? Mostly you do this FNACs, fine needle aspiration cytology, and pap smears you receive from gynec department, for cervical cytology, and also you receive urine samples for cytology. You receive fluids for cytology. Fluids in the sense what fluids? You receive cerebrospinal fluid by lumbar tapping. You receive ascitic fluid, pleural fluid, pericardial fluid, synovial fluid, ball fluid, that's bronchoalveolar lavage. And also in few, sometimes very few instances, you receive sputum for cytology, which is diluted and then it is kept for cytology staining. And all this cytology staining of the slides is done most commonly using Leishman and H&E. In cases of TB suspicion for AFB, to check for AFB, you would request for ZN stain. FNACs, coming to FNACs, most commonly seen in our college are for lipomas, sebaceous cysts, thyroid, and breast lesions. For thyroid and breast specifically, and for lymph nodes less than 1 centimeter in size, we do it under the guidance of ultrasound. Books for cytology are for Pap smear and the Bethesda system for reporting cervical cytology, the standard book for Pap smear. And for other FNACs, we refer to Oral's cytology. The Pranab cytology is a very standard book. It is a high volume book. And so I have referred to oral cytology and the Bethesda system for cervical smears, Pap smears. And in the lab posting as well, this is clinical Pathology Essentials of Clinical Pathology is a must book for every pathology resident. It covers the pathology as well as the biochemistry part, and it is a part and this portion it comes under paper 3. So every pathologist should have must essentials of clinical pathology by Kautalkar. Coming to histopathology, the surgically resected specimens, the biopsy specimens, these are sent for histopathological examination to the department. These specimens are grossed. Firstly, as soon as you receive the specimen, you check them externally and do grossing. Grossing means literally you cut them into small pieces to make them amenable for your microscopic examination. That is grossing means cutting into small pieces. So after grossing, I mean there are certain protocols for each organ about how to gross. For those few manuals and books are there that I'm going to tell you about. After grossing, that is literally cutting them into pieces, you keep the specimen for processing, that is fixation. First, you fix the tissue using formalin, and the tissues, after you cut them into small pieces, you embed them in cassettes. Cassettes, square small cassettes will be there. You keep them in embedded, and you keep them in the tissues, the cassettes. You keep the tissues in the cassettes. Embedding means you orient the tissue such that the surface which you want to examine under microscope it comes directly under the cut, directly comes under the knife. Then in the cassettes you put hot wax. After cooling it it gets prepared into paraffin wax blocks. And these wax blocks are cut using a microtomy. Section cutting is done using a microtome. After section cutting, these serial sections that you get this ribbons of wax which contain these tissue sections, and these are mounted onto slides, plain glass slides, and kept for staining. You can do routine stains like H&E, Leishman, and special stains, for example, Congo red when there is suspicion of amyloidosis. For any fungal, if there is any suspicion of fungal elements, then you request for past staining. And IHC stains are done at higher centers. IHC means immunohistochemistry. Immunohistochemistry literally means immuno means to do with antibodies. Histo means tissue. Chemistry means reactivity, whether the tissue is reactive to specific antibody staining. That is immunohistochemistry done at high-end centers. In my college, IHC is not available. We do routine H&E and special like Congo red, and for past staining we do it. After the slides are stained, they are ready for microscopic examination. The histopath for grossing, you have certain manuals. Each institution has their own grossing manual. But in our college, we don't have a separate manual for grossing. My seniors who went for conference to Mumbai at the Tata Memorial Hospital, they brought a manual from the Tata Memorial Hospital and we are following that. I mean, we read them. And as well, there are certain protocols that you can search online, like CAP protocols and RC path protocols. That is College of American Pathologists and Royal College of Pathology guidelines. I mean, each organ system has a different grossing protocol. So there are protocols for each and every organ systems. And few books for grossing are this. Shamim Sharif is the basic and easiest book. It covers the histology and the grossing for each and every organ, how to do grossing, what bits from where you have to take everything, and for each and every condition is described in detail, and it's very simplest form, in simplest possible form. And I do read Shamim Sharif. And in first year, you have to know the normal histology first, so that later you can know what is abnormal. For normal histology, you can read IB Singh's histology that I do read, and this is a very standard book like Bible of Histopathology, Rosai and Ackermann's Surgical Pathology. It is a two-volume set. It gives in detail the microscopic features of each and every organ, the images, high and low power microscopic images of each and every organ system, organ tissues, everything is given, and also a very detailed description of each and every disease is given. Even our faculty members for reporting, they follow or they refer to this Rosine Ackermann's surgical pathology for the descriptions. And in our college, our faculty suggests us to read for autopsy, which comes under practical exam. It carries 30 marks and it is very standard. 30 marks are stable marks. It is like we simulate the autopsy atmosphere using gross organ specimens. We receive and we get gross organs are given to us, and we have to imagine that we are doing autopsy. And heart autopsy is the most important. We do for all organs we do autopsy, but heart is the most important for exam. Fetal autopsy is also there. For autopsy, we refer to Ludwig's manual of autopsy. And last but not the least, the Bible of Pathology, Robbins, 11th edition. It's a two-volume set. Thank you all. If you find this content useful, please like, share, and subscribe. In our next video, I'm going to tell you about four papers for theory examination, and what topics are there in each paper, how many marks they carry, and also for the practical exams. See you soon.